Assalamu alaikum, this is Fama Zara, and today I'm starting a topic of the electrolyte disorders. The first electrolyte disorder that we are going to discuss today is magnesium. Now, magnesium is mostly the neglected ion of a body. We don't give it so important according to it deserves. Fine. So why this magnesium? Let's just start our discussion, and please watch the whole videos. You'll get a lot of new information that is not available in most of the books, plus on YouTube too. So magnesium, first of all, why it is so important? It is the second most common positive, means the cation in the body, and it is the fourth most common ion in our body. It's very important. And this second most common ion is intracellular. Of course, second to potassium. Potassium is the first most common. So magnesium, this is its basic intro, but now we are going to discuss that why it is so important. We'll just go through the whole discussion today. First of all, its normal levels. We just start with some basic intros, that what are the normal levels of magnesium in our body. Now, how to remember it? Just remember 18 to 25, these two figures, and then add a point. So it's 1.8 to 2.5 milligram per deciliter is normal value of magnesium. Now, moving on to our next point, that okay, this is the whole value, we get it. Where is the magnesium located in our body? So what are the locations of magnesium in our body? Now, this is very important. Magnesium is present in two major sources, bone and within the cells. So 2/3 of the whole magnesium of our body is present in the bones, and 1/3 is present in the cells. Now I know the lecture is going a bit boring because these are some of the basic intros, but now we're going to start the interesting part of the magnesium. Its clinical correlates, so now it will become more interesting. Stay with me. Now, basic magnesium, what are the three major points of magnesium by which its levels are regulated in the body? So just consider three major organs of our body. Fine. How is magnesium? Now we're just starting a very important discussion, so please listen it carefully. First of all, talking about the whole, this is our whole of our GIT tract, and this is the whole GIT tract. So first is that GIT is important in absorption of the magnesium. Second important is our kidneys. So I just try to draw a kidney. This is its adrenal gland above it, pelvis and the ureter. So second important organ is the kidney, and third are the bones and the muscles of our body. Now we'll study in detail why they are important and why I've made these three cute illustrations in front of you. So just keep these illustrations, because I think the pictorial memory is more effective in memorizing rather than the writing memory. So starting with the GIT. Now major that the magnesium, of course the source of magnesium will be our diet. So the major magnesium that we eat from our diet is absorbed from our small intestine, of course, like other minerals. But which part of the small intestine? This is very important. It is absorbed from distal jejunum and ileum of our small intestine. So these are the two major sites of absorption of the magnesium. Now, how they are absorbed, it's very important. So just consider, this is suppose a cell of the GIT tract, and this is another cell, and of course this is another cell. So major of the, and this is of course the lumen of the intestine, but we are considering the cells more important. Now suppose patient has the person we has taken magnesium containing diet or magnesium containing medications, then the maximum part, means the 85% of the magnesium will be absorbed by this paracellular route. What is that route? Called paracellular route. And remember, from this P, passive. So it is basically the passive transport means it doesn't require energy for this transfer. And how much? 85% of the magnesium is absorbed by this route. Okay, I get it. The remaining 15% is absorbed by the transcellular route. Now, transcellular is the active route, and remember, from this T you can remember that it is play an important role in tight regulation of the magnesium levels. Like, of course, like if you remember from a daily practice, that one work is done roughly to just increase its magnitude, and then we do fine tuning of that work. Like our paintings, we just quickly draw a paint, and then we do the detailings and the fine tuning to make it more impressive and to finish the whole task with more precision. So apply this that thing here, that major is absorbed by the paracellular route, and just a few 15% of the magnesium is absorbed by the transcellular route, that is the active absorption of magnesium. Where it is happening? In distal jejunum and in the ileum. Now, why it is important? Because of course it is absorbed from this side, so that's why it's important. And second, why it's important is this another correlate. I prefer discussing clinical correlates because they are more important for us being medicos. So this paracellular route, of course some transporters will be responsible for this absorption, and very important, those transporters, I'll write here, they are vitamin D3 dependent. And why it's important? That if vitamin D is increased in our body, then there will be increased magnesium absorption. This is very, very, very important. Fine, because it will help us in understanding the hypo and hypermagnesemia. So this was the whole study of the absorption of the magnesium from the GIT tract. Now moving on to this second organ, which is desperately waiting for us, that excuse me, you've drawn me and you're not explaining me now. So this is the, as you can all see, it's of course the kidney. And what is the work of kidney? To excrete, along with other works too, but this kidney is important as it is responsible for magnesium excretion from our body. Now it's not just that is just important for excretion, of course it reabsorbs magnesium too, but by increasing and decreasing the reabsorption we can adjust the excretion quantity of the magnesium. Now same as we discussed GIT, what will be the site where this whole thing will occur? That is the thick, now you have to remember these are very important. The thick ascending limb of loop of Henle is the first site, and the distal convoluted tubule is the second site, that we usually write as DC and T. Fine. Now it's very important that, okay, you've told me the sites, now explain me how is magnesium absorbed. Now it is very, very important. I've searched a lot and then just find this whole mechanism. So please just listen very, very, very carefully. Imagine this is a cell of thick ascending limb of loop of Henle. So I write as abbreviation TAL. This is its luminal side, and this will be of course the basolateral side. Now you can easily remember that if someone asks randomly that, okay, what is the basolateral side? So just remember from this B that it is towards the body, and from this luminal side of course it's towards the side of the lumen of the tubules of the kidney, means it will lead to the urine loss. You can remember it from the luminal side, L for lumen and L for loss in the urine. So yeah, this is the whole thing. Now we know that there is a very, very, very important transporter in the thick ascending limb of loop of Henle. I'll make that transporter so here. What does this transporter do? It causes 1 sodium, 1 potassium and 2 chloride. So it causes absorption of sodium, potassium and 2 chloride molecules into the cell of the thick ascending limb of loop of Henle. So this is the transporter. Now starting our discussion on this, that's very important, that from the tubules, sodium, potassium and 2 chloride are now absorbed into the thick ascending limb of loop of Henle cell. Fine. Now when they're absorbed here, what will be the fate of these cells? This sodium here is present on the basolateral side, a very important channel, that is the sodium potassium ATPase channel. Now what does this channel do? This sodium is then actively, it's ATP mediated, so it's, I'll write here, sodium potassium ATPase channel. Fine. So by this sodium that has come here is now absorbed actively into the body. This is the interstitium and then to the blood vessel, and this further some potassium from a body is excreted here. Now this potassium and this potassium will not reabsorb, but this chloride here, there is another channel present here, that is chloride Cl, its name is, I'll just write it here, ClCkB. This is the name of the channel. So by this channel the chloride is also absorbed in the body. Okay, now what will be the fate of this potassium? What will happen that here are some channels here. What they do is, what is the name of the channel? ROMK. It's not important to memorize the name, is just for information purpose. Now this potassium and this potassium will then get recycled back into the tubules. So remember, everything is going back to the body except the potassium that is reabsorbed into the tubular lumen. Now please listen very carefully here. What is happening, that these ions are lost from the urine, like reabsorbed from the urine into the cell, into the interstitium and to the body ultimately. But this potassium is recycled again into the tubular lumen. So what is happening, that positivity is being created in the luminal side and negativity towards the interstitial side. Now this gradient is very important. This gradient is approximately of 10 millivolt gradient. Now what does this gradient do? It plays a very important role in calcium and magnesium absorption. Now just see that here is this calcium which is positively charged +2, here is magnesium which is positively charged +2. Now this positive will repel this positive, and as a result magnesium and calcium by these channels present here, suppose, just a second, let me make it more clear. Suppose this is an other cell here and this is the paracellular, actually this is not so much space but it's just for illustration here. By these channels they start to absorb into the body. Now this why? Because they are repelled by this positive charge, attracted towards interstitial negative charge, and the magnesium and the calcium will start to absorb. So this is the mechanism by which magnesium along with the calcium is absorbed, or more precisely reabsorbed from the kidney into the body. So this is very important, listen it very carefully, it will help you a lot. Fine. So this is the role which kidney plays. Now of course when there will be decreased reabsorption of magnesium, what will happen? Increase magnesium excretion and magnesium will start to lose from our body, which is the work of which will be excreted in the urine ultimately. Fine, this was an important point of kidney. Now moving on to the third two organs which I've explained, which I draw and they are just waiting for me. Suppose this I have tried to make a bone, and this is the muscle. I'll just make it red because muscles are mostly red in color. So this is muscle. Now what is the role of these two? That they are basically the storage sites of magnesium. Magnesium is stored here. Fine. So whenever there will be osteoporosis or muscles breakdown, which is a condition called rhabdomyolysis, what will happen, that magnesium will start to come out from them and can cause hypermagnesemia. So this was the whole basic introduction, that how magnesium is absorbed and then it's excreted, how and where is it stored. So remember these three organs, they will help you a lot in understanding hypo and hypermagnesemic conditions. So we just discussed it all. Now a very important point, that okay, we have discussed the whole importance of this magnesium, but now just tell me that what are the functions of magnesium in our body. They are very important, because if you know the functions, then you can easily understand that when levels of magnesium is going up and down, how will they affect our body. So what are the functions of magnesium in our body? Now understanding it is very, very, very important, so please listen carefully. Starting, its first function is, I'll make this star so that you can never forget throughout your life, this is ATP. It is very, very, very important in the energy metabolism of our body. So if we have hypomagnesemia, then we have less energy production in our body, and our many systems of the body will get affected. Okay, so this is its one role, that it plays an important role in ATP generation. Okay, second important role is that the proteins of our body, so it's very important in the synthesis of protein. We know how protein is synthesized, DNA transcription, so it is very important in the transcription process of DNA. Then it is important in the protein synthesis, plus it is also important in the fat synthesis also. Fine. So another very, very important role of magnesium is that a very important hormone. What is the most important hormone in diabetes? I hope you know all. It's insulin. So it is very important in the activity of this insulin. First, it's important in the synthesis of insulin. Then it improves the insulin sensitivity, of course, of the target tissues. Plus, very, very important for glucose utilization. So what do I mean from this all discussion? That for activity of insulin, for insulin to perform its function properly, magnesium is required. That's what I'm trying to explain you here. Fine. Now imagine this is a cell, and here is this insulin present. For insulin to act here, magnesium is required. Then for glucose to be utilized within the body, magnesium is pumped into the cells by mechanisms for glucose to be utilized within the cell. So it's very, very, very important. And mostly in diabetic patients who are having type 1, means insulin deficiency, or type 2, in which there is insulin resistance, they are mostly hypomagnesiemic patients. So we give supplements of magnesium to improve their activity. Okay, again, it's a very important function of magnesium is that it is required. So basically it acts as a cofactor in many of our reactions of the body. So it's important in that case too. Plus, for all the B vitamins, B1, B2, B3, B6, B12, all the B vitamins, their activation require magnesium. So an important clinical correlate here is that if a patient is having normal vitamin B levels, but he is having so less magnesium in the body that these B vitamins are unable to get activated. So what will happen, that despite of present adequate levels of these vitamin B's, deficiencies symptoms will start to appear. Why? Because they are not acting properly. So that's why magnesium is very important. Now, out of all, a very, 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 very important function of magnesium or role of magnesium is that this is suppose the muscle. Within the muscles, it antagonizes the action of calcium. Suppose this is a muscle cell along with the cardiac muscles also, plus other muscles of our body. It antagonizes the action now of calcium. I'll write here in bold words because it's very important. It antagonizes the action of calcium in the muscles. Now what is the action of calcium? Is to contract. So what does magnesium do in the muscle? It relaxes the muscles. Now how? This how is very important because in medicine, in patho, in physiology, even in pharmacology, you should know that if something is happening in the body, then what is the reason? Because if you know the reasons, you can easily get grip over that whole topic. So imagine this is a muscle cell and this is the sarcomere here. When this sarcomere, when the we know that actin and myosin filaments, they react with each other and contraction occurs. So suppose contraction has now occurred and now we have to relax this muscle. This calcium is now pumped, of course, into the sarcoplasmic reticulum back, and when it is pumping inside, magnesium is released outside. This magnesium, which was coming from outside, of course, is then important to relax the muscles. Fine, so this is the whole mechanism by which it occurs. So now just apply our concept that if suppose there is hypomagnesemia, then what will happen? The muscles will remain in the contracted state. They will not be able to relax properly. So spasm will be generated and many other spasms, seizures, muscle cramps will develop. So this function of magnesium is very important because it has a lot of clinical correlates. This little function of magnesium, it can be applied for treatment of many diseases. How? That suppose if the patient is having asthma, we can give magnesium to him. What will they do? It will cause release of the bronchial spasm. So patient simple symptoms will improve. Fine. Now if the patient is having arrhythmias, but we'll give magnesium to that patient, and what will happen? His rhythm will start to improve. Plus, if the patient is having heart failure, we give magnesium and it's effective. Then, if the patient is having seizures, we'll give magnesium, and what will happen? That his seizures frequency will decrease, and patient, along with of course the main medication, but magnesium will help you a lot in managing such patients, that the frequency of seizure attacks will be decreased. Similarly, in case of cramps, like post pregnancy cramps, we give magnesium for relaxation of the muscles. Plus, magnesium also relaxes the smooth muscles. So in pregnant ladies who develop eclampsia or pre-eclampsia, we give magnesium to them, and it performs very good role in them, that it reduces their BP. So just see, this little magnesium, which is so much ignored mostly, plays in so many important roles of our body, and by giving these supplements we can treat many life-threatening diseases of the body. Along with asthma, it also is effective in COPD patients too. Plus, now we know that our clotting factors are also basically proteins, so it is very important in the formation of clotting factors also. Now I'll write here so that you don't mix it up. Another important function of magnesium is that for our blood, just to remember, if this is the blood vessel and bleeding is occurring, so for our blood to clot here, we also require magnesium. Plus, a very important role of magnesium is that parathyroid hormone, which plays an important role in maintaining our calcium and phosphate levels in the body. It causes increase in calcium and decrease in phosphate. So for the synthesis and release of parathyroid hormone, magnesium is required. So we can't treat hypocalcemia unless and until we have treated hypomagnesemia. So it's very important. This concept will be repeated in many of the topics of this unit. So I hope this video helped you out. Just a quick recall of the whole topic or discussion we did today is that, first of all, what is magnesium, its levels we discussed, and then we talked about three major organs. What? GIT, for absorption of magnesium, kidney for excretion of magnesium, and it stores that are bones and the muscles where kidney magnesium is stored. Moving on to its functions, this, remember this sign, its importance in the energy metabolism as cofactor in many reactions: protein synthesis, fat synthesis, clotting factor synthesis, insulin sensitivity and glucose utilization, insulin synthesis, parathyroid hormone synthesis, antagonizes the action of calcium in muscles and in neuronal activity. And these are all the clinical correlates of this function of the magnesium. So let's just end our discussion today. This is all about magnesium that you should know, because unless and until you don't know the basics, you can't understand the whole hypo and hyper conditions of that mineral. So thank you so much. I hope you liked the video. I hope this material helped you a lot. And please like, share and subscribe my channel, and most important, please share it with your fellows so that my aim of helping you guys all get accomplished properly. Thank you so much. Allah Hafiz. See you in the next video.